Don't be afraid to go on a whim and interest, but be smart. Sometimes you got to keep your day job to do something else until it's proven to be something you can replace. But at the end of the day, don't be afraid and say, I woulda, coulda, shoulda, particularly women. Don't feel because you had kids, you didn't think you needed to finish school, go and finish school. Find a way to make it happen. But if you have a supportive significant other or spouse, they'll support you. If they believe in you, go do it, because I don't want you to have regrets. And that's true in anything that you wish you had done. But make sure you seek out advice from those that you trust.
Hey, everyone. Welcome to the show today. Welcome to the BYA Podcast. And my special guest today is Dr. Brad Jackson, Planned Performance Medical Director for Elevance Health in Westerville, I believe, Ohio, or Columbus, Ohio.
That is correct. I'll take both.
Yeah. And just as a disclaimer, Dr. Jackson has been a great friend of mine for 30 years. I trusted him with my most valuable possessions in life, which were my children, where he served as a pediatrician for a couple of my kids. And so if I slip between Dr. Jackson and Brad, I apologize. It is not meant for disrespect. It is all out of admiration and love, my friend. How are you today?
I'm doing wonderful. And thank you for having me on your podcast. I greatly appreciate the opportunity, to share my story and, where we were able to reconnect, later in our careers and, in terms of the importance of social determinants of health and just life in general. And I think, our paths always come back to one thing, about our own well-being, but also the well-being of others.
Yeah, no, that is definitely for sure. And it has been a pleasure to circle back. I mean, we have known one another for a number of years, and I'll save our age and the number exactly. But I think when we first met, I was actually in medical at that time with Baxter Healthcare. And then, went into the franchising game for a number of years and then back into healthcare. So it has been fun to circle back and to reconnect. It's not about my journey today, though. It's really about celebrating yours. And you have been in the game for a very long time and impacting a lot of families in the Midwest and even on the East Coast, throughout your journey. I'd love for you to talk a little bit about your background, Dr. Jackson, and just, where you're from and some of the challenges that you had to go through in life in order to get to where you are today, because I think that's always inspiring for people, regardless of the field. I think the one key thing is, there's always been opportunities and moments in life that have been defining moments where it's like, I've got to overcome this obstacle. I got to get through this. Everyone goes through challenges. Everyone goes through those moments where they have to BYA every day and stay focused and make it happen. So I'd love to hear your journey and have you share that with our group.
Sure. I'll give you the short version. Born and raised in Cincinnati, Ohio. And, my parents were rooted into, the foundation of importance of education. And for me, I had an easier road with regards to, starting school at a very early age. I don't know if you knew this, but I graduated from high school. I was 16 years old.
Oh, wow.
But I had this inspiration to really want to do big things. I wanted to be an attorney. I wanted to be an archaeologist. Wanted to be a veterinarian. And then I said, I think medicine's my passion. But what was interesting, I went to a high school, Covington Latin, in Covington, Kentucky, and I was at the early age of 12 years old, commuting back and forth. But what was interesting about that journey was thinking big in terms of where my place would be and what place I'll serve in the community long term. And my father particularly was a DJ. He did everything, a DJ, barber, and ultimately went into social work. So he was involved with troubled youths. And so I got an eye on, what could I do to impact that population? My mother was a nurse and saw the challenges she had getting into nursing school, that she couldn't get into nursing school in Cincinnati because they just wouldn't allow African-American women to get in. She had to go to Chicago, to Providence Hospital,
wow,
which is where there's only so many nursing schools in the country. And she happened to be at that black hospital where she had to go to get her nursing training. Came back and, through parts of racism back in the late 50s and early 60s. She couldn't get into the university hospital to be employed, even though she had one of the highest nursing scores. That being said, she had to work at Jewish Hospital, which is, interesting, which is a hospital I was born in Cincinnati. But I understood their journey. And then I never thought that where could I do better? It was really they put me in the right place at the right time. Was blessed to have a classic scholarship to the University of Cincinnati. So imagine that. Went to Covenant Latin, studied Latin, one of the, the better Latin students, and got a scholarship there. And so I did classics for a couple of years. Didn't think I was going to be majoring in Greek and classics. But what I realized, there's a foundation for medical terminology with Latin words. So I took that and I said, no, I think I'll, go into medicine. Majored in biology at the University of Cincinnati. And from there went to the Wright State University, Boonshoff School of Medicine, and was really entrenched into community medicine, which is the foundation of the work that they've done there, and just blessed to been in that setting and get that exposure. But then I had this bigger vision of wanting to go to the best pediatric institution to train in residency, and was blessed to come back to Children's Hospital Medical Center Cincinnati, which is the number one pediatric institution in the country, for those who don't know that by U.S. News Report. And so having had that pleasure of training there, I saw the worst of the worst and got a great foundation, which has been helpful for me throughout the years. And then from there, I did a public health commitment with Lincoln Heights Health Center for about 3 years, actually, where I got a foundation of what it looked like to work for those individuals who were less fortunate, the more vulnerable populations, while I also did private practice. So I was juggling between that. I was also doing some neonatal care, and I wanted to get my hands on a variety of things. But at a very early part of my career, I started getting into understanding managed care, which is where I am today. And that was understanding the needs of those vulnerable, particularly those of Medicaid, and understanding that the level of service and care that I have. My training did not discriminate. My training said you provide any care for those who need that care. And that being said, I said I have a unique interest in these groups. For those who either go from Medicaid to commercial, didn't matter. I said I want to understand this group while also doing private practice, where it's a little bit more mostly commercial. So I did that throughout most of my career in practice, pediatrics for 27 years, including, taking care of your amazing family. Having to be around you and Phyllis really gave me an ideal of what parents want in their kids to get them to that next level. And I've been blessed with my patients that are lawyers, doctors. I have 2 of my patients that have actually won Super Bowl rings. So I've got the spectrum, but with the foundation of them, they had strong, sound families. Yeah. And to me, that was important. And there were some that did not have those opportunities, but they made the best of it. At least I wanted to make sure they had that opportunity. So it really spanned to a part. When I got to that 27th year of practicing, I said, I need to really have a larger presence. So currently, I'm the chief medical officer and the plan performance medical director for the Anthem Medicaid plan in Ohio, where I manage about 210,000 lives. I have a greater impact in policy making, clinical coverage policies that look at how we're managing our members, as well as managing $1 billion business set to really be able to say, hey, I have a sphere of influence for getting the best from our members. And one of the things we mentioned is about the importance of social determinants of health, particularly for this vulnerable population, and realize that social determinants probably account for 80% of what these individuals are going through. But many people in the past never thought about these things. They never talked about how they get to the point where transportations, the fact that they're not employed, understanding the barriers that that does have health implications, food deserts, and housing insecurity or housing issues that come through. And I said, these are things that I have some level of influence on. I need to make sure in all the clinical work we do, whether you have congestive heart failure, whether you have asthma, there's an impact on those social determinants that we need to understand and not just state that they're there, do something about it. And I will really give a lot of credit to the Ohio Department of Medicaid that has really been pushing the importance of that as a population health model in managing, coordinating care. Those things are important. It's not just managing the asthma, it's the factors that lead to the asthma.
Exactly. Exactly. Now, you know what? You bring up some great points. Number one, you were the OG Doogie Howser. So I just I just realized that.
I couldn't even
never
drink
knew
when
that.
I went to medical school. I couldn't even drink. It's like, man, that's crazy.
I know, like, right? So it's like, well, you know what? But that's not a bad thing either, right? So I was pretty young when I graduated from college too. I was barely 21, and so I get it. But you mentioned social determinants of health and just like a lot of things. It was interesting to me to really now understand like your parents' background, and I think how many ways that shaped and influenced the role and the impact that you're having today on the communities you serve. So, I mean, it's really cool that sometimes as we grow up, we don't want to be like our parents and, oh, my God, are you kidding me? But then as you look back, you begin to really see the influence and the impact that they had on your life. And it's great that you had that foundation in order to really mold you. And a lot of times people don't have that. They have to rely on coaches, family, friends, their network, et cetera. The other piece that I think is so interesting is the social determinants of health piece. I mean, I grew up in an environment where my family needed services like that. I mean, my mother was a diabetic, my breast cancer survivor. I had uncles who had amputations and suffered with a lot of just chronic diseases and stuff like that, and really needed transportation services that just weren't around then. So they had to rely on family members. And I think that's kind of my tie and why I'm so passionate about it today. But I think not only that, even as a leader in business, I saw a lot of people that, quote unquote, had drama in their lives. But now as I step back and I'm more reflective, I'm like, man, I could have been a lot more empathetic leader had I understood social determinants of health and really how do we go about helping them get the help and services that they need so that I don't have to go out and hire new people because I'm frustrated or whatever. Hey, let's get them the help that they need and retain these people and keep them productive. And so I think there's just so much there. A path that we could go down in regards to social determinants of health. And I think just a lot of folks and the importance of you kind of spelling out how today research is showing that 80%, and I think that's worth repeating, 80% is not like genetic. It's really about your environment and what's going on and in and around where you live and work and play. And so, share that again, because I think that's so important for people to really understand and grasp.
So if you think about the outcomes that we have, the impact of those outcomes is not as much the organic disease itself, congestive heart failure. You look at asthma, you look at, there's so many things, even cancer, all these things have 80% of their origin is probably coming from some social determinant. That's not just for those who are getting federal aid assistance, that's the whole society. Yeah. So if you don't address those issues to understand they have asthma because they have poor housing situation. They're in old, dilapidated, mold infested places. You have to understand those things. Did you understand that they did not have electricity? They don't have refrigeration. So how does a diabetic manage their insulin when they don't have refrigeration, much less electricity? Correct. So you have to get down to meeting members and patients where they are to understand the circumstances that are affecting the bigger picture. That in itself is contributing to a lot of how much our outcome costs are. And Correct. Our constant spend are related to factors that we need to address in order to help that long-term care. Yes. And that, many managed care plans, insurance companies are getting to understand that they have to place those resources in whether adding value-added benefits to individuals, whether it's transportation cards, meal cards. And I think this way, when I take someone from a rural part of Ohio, and I'll take the southeastern part of Ohio, which is in an Appalachian area, I need to understand that you're not going to find specialty providers in that area. Correct. So they're going to travel 50 plus miles to get to where they need. I say, remember, to go from that point from point A to point B is time, transportation. Did you know they get hungry? Did you thought they didn't have meal cards? They don't have that along the way. And many of them will avoid that because they're thinking, I can't get there and I can't eat. If I'm diabetic, I got to have the right foods, culturally sensitive foods that are available to me in that period. So we have to be a far-reaching thinking company to say, maybe we need to offer that as a value-added benefit to get, we might connect with Uber, Lyft, give them this meal card when they're there. So when they're at the hospital or place nearby, they can get that food. I'm at a better chance as a plan to see reduced costs because they are going to manage all of those different elements in view of their chronic disease and get back to point A, same transportation, and have a better experience. And they're more likely to want to make that next visit because their first experience was a good one. So I believe in thinking big. And I had a conversation with a large provider group in the state. And we're going through this quality improvement program, and this involves behavioral health. So we're looking at, for all of our managed care plans, Medicaid with Ohio, we're looking at individuals, children, who have a behavioral health diagnosis that are in the emergency room, that they get a follow visit within 7 days. So I'm going through these scenarios and I'm thinking big. I said, I've been a provider. I've been out there. I said, how do we get them to that visit within 7 days? And just sharing with them, these are those things that are important to that member. Transportation, getting flexibility and scheduling. You never knew that they work third shift. So you need to be able to provide in your electronic medical record system. They can get in with a secure password to schedule that appointment within that time. And here's one of the things I can do for you too. Let's give them incentive. It may be $50 to $100 because we know the importance of it. It's not because we're going to get this quality improvement, but those things will entice them to get from point A to point B and have a much better experience, and hopefully their health outcomes will be better.
Well, and ultimately, a $50 food voucher or transportation has an impact and a ripple effect throughout the entire healthcare system as far as driving costs down and providing better outcomes and saving in medical expenses. And so that's just excellent stuff. That
let me just mention one thing, Phil, what it is what is your return on investment?
Exactly.
That small investment in getting the right transportation, getting them the meal cards, that small investment will hopefully improve the outcomes that you're hoping to get. Don't ignore those things, because if not, you're going to be, chasing your tail, trying to manage the asthma, but realize there's other factors that are contributing to it.
Yeah. And, when I was doing my work and as a senior vice president of social determinants of health and community engagement, it was interesting to me that a lot of people weren't even aware that these types of benefits existed. And the reason why I'm saying this, as an employer in the past of like 400 people, I had numerous people come to me and say, hey, I need to take the day off because I need to take, grandma to the hospital or the specialist or whatever else. I mean, I grew up in a rural town that was 35 miles away from the city. So it's like we had to go to town to hunt, but in order to do that, my dad had to take time off to take my mom to the specialist, right? So that was an impact to the family, where today there are, services available, transportation services, et cetera, that can take that person to the physicians or even reimburse that person who's taking that time off. And so that is something that I think, and I really wish the plans as well as, the providers, the transportation providers would do a much better job of, as far as getting out into the community and educating the community as to these are the benefits that are available to you in your family as a result of being on our plan.
Yeah, stay informed. But I think you have to be proactive, whether it's text campaigns, when you have new member packets. So in our welcome packets, we want to make sure they are aware of these. And there are various apps that some plans, I know with Anthem, we actually have an app. It's called a Sydney app, which I have as an employee, that we have these apps that it's actually trying to be user-friendly, appropriate language, bilingual. All these things are important features to communicating with them these benefits. Because many times for just preventative care, they don't realize all these things are covered services.
Right.
You need to know these things. Be aware of those things that you have. But we also have to be proactive as a managed care plan to make sure they know that they exist.
Yes. Ultimately, the end game is, and all of what we're talking about is better health outcomes and hopefully even better reductions in cost as far as the healthcare system and the stress on the healthcare system. One of the areas that we've talked about as far as reducing healthcare costs has been around technology. And I'd love to kind of get your insight into how is AI kind of playing into all of this. I mean, obviously, I'm a little biased, but I talk a little bit about AI and connect you to folks. But let's talk a little bit about that. Like, how are plans today utilizing AI technology to drive down healthcare cost? And maybe even as a consumer, if you will, or an end user, how can I utilize technology today? What's one of the best tools that I actually have at my disposal to manage and improve my health?
Great question. So it's a pretty broad, when I say a broad general question, it's a great question that can be broken down in different segments. First of all, let's begin with managed care plans. At least I can speak for Anthem and Elevance Health, which is our parent company. One of the things that's important is how do you utilize AI to improve efficiency in the workplace? We use that tool and they encourage it. In terms of the information that you have in your system that can be brought together by just asking the question. So various systems to say, hey, I want to, where's my last conversation that I had with Phil? Can you bring that information up? It draws information, but time is money, money is time. So how do we use it for the benefit of our members? We're using a lot of technology to be able to eliminate and minimize administrative burdens for providers. So a good example, if we're able to have access to your electronic medical record system, all your information's there. You don't have the time to sit and fax all this data to us. Having HIPAA compliant and secure access allows us in our system to extract only that information that you allow us to look at, to bring that information in, and we can make decisions based off information that's in their medical records to say this inpatient hospitalization should be approved.
Yeah.
Without having to go through so many different steps. And I think that that's an important piece to be able to get the right information out, but it doesn't excuse the opportunity to do that peer-to-peer conversation with that provider. And being able to have that, because sometimes what's in the notes may not clearly state what's going on. So that is one of those applications. But the important things is AI is going to allow us to understand patterns, understand cultures with the information that is shared by the member or the patient. So when they share that information, this technology is allowing us to extract that information and get that information that we would have never been able to peruse the notes with and understand. Now, you have to be diligent in understanding the limitations of AI. AI doesn't mean you can't go out and ask that member that specific question. But AI is designed by humans, but be understanding that there are human errors. And so you have to really be able to use all the tools, but it will be an effective tool now and going forward. So get ready for it if you haven't. And it's there. It's in your homes. When they talk about Siri hearing conversation, that's AI. They hear all these things. So understand that it's there. Don't ignore it, but understand how can you use it to the benefit of an individual's well-being. And that's one of the things we're doing at Anthem.
That's awesome. No, I think it's great work, and I think the best is yet to come. I want to talk a little bit about a topic that I know is near and dear to you, and that is in regards to mortality rates amongst women and in particular Black women in the country when it comes to giving birth. The World Health Organization, I think, said that the mortality rate for women, for Black women, I think was like 2.6 times higher than the national average for Hispanic and white women. And I thought I even heard one time more higher than many third world countries, which is a deep, deep concern when you think about how developed of a nation that we claim to be. Yet in certain pockets, we're really having these challenges. And, I don't think this is just an urban issue. This could also be a rural issue as well. But I'd love to kind of hear your thoughts on this and not necessarily, we know that these issues exist, but really about what is being done, to correct some of these disparities.
Well, you highlight on a very important piece of our overall healthcare, and it is healthcare disparities. And that in itself is a major healthcare disparities, not only mortality of Black women and those in lower economic status, but also infantile mortality. They're all kind of tied together. Yeah. One of the things that I know from Elevance Health and Anthem as a whole is that you have to be intentional. It has to be a part of your pro forma of activities that has committed time and resources to, first of all, allocate. We have a maternal child division in our enterprise that helps to have special programming and management and an advocacy program for these specific issues that are going on. The first thing is education, educating our providers, educating our families and members of the importance of screening. Early prenatal screening is vital and staying in contact. One of the other things that, and I'm in the Medicaid space, so we have to kind of go under the governance of the Health Department of Medicaid, is doula services. So we actually have a doula program that is being incorporated as we speak and hopefully starting up. We need advocates for mothers during the pregnancy. That voice, that care they can provide, that will be reimbursed. And the reimbursement is pretty significant to say that we are committed for this. So we're in the process of making sure they know how to get the certification. And these are non-medical services. These are people who are not trained as nurses. They're not any other healthcare provider, but they provide a support system and advocacy for mothers during pregnancy. Those are some of the things that they are individually mandated by certain states. We are in the process of doing it. We have some other states that are really still trying to do this thing, but those are things I think are going to be impactful. But I do believe a plan has to have a plan in place for screening measures, making sure they get the appropriate screening for the mothers, because the impact is wide. If we manage and do well with the moms, stay in tune with them, looking at home programs. I know a program that I work with in Cincinnati called Every Child Succeeds, that I was on their board and was uniquely involved in looking at their programming. These create home visits with the mothers. And these are young, low-income mothers, first-time mothers, that we go out to the homes, do home visits. And what they were doing is making sure that every aspect of their care is there, even if they had to go to visits with them. Yeah. So again, a good concentration of the disparities are those who are low economic status, but we're also seeing this with mothers that are college educated. Sure. We've been seeing, and I think it was an officer, I can't remember, it was a physician in, I think, the state of Indiana who died unnecessarily, seen in the emergency room, but died because of complications that were not monitored the same way as maybe the average population. So it's hitting all aspects of socioeconomic classes in African-American population, but that's not right. Yeah. And so when the data clearly states this is an issue, and the question is, what are you doing to put programs into place that are safeguards for these mothers to term and postpartum? So that means that that baby's born, the mother delivers, make sure that they get all the care until that 6-week visit. Postpartum depression is real. Yeah. Yeah. So not only the neonatal, prenatal depression, postnatal depression is even more significant. We need to also manage behavioral health, as well as the issues with drug addiction. We got to manage all those things. All those things are factors in impairing our women, if anything, Black women, in those situations where that may exist. So we need to support them, understand it, meet them where they are, and provide them with the services they need to have a much better outcome.
And Brad, what's being done like at the at the school level, the med school level, to kind of help with the development of the future generations of physicians, to kind of spot these challenges and talk. I'm sure. Are you going back on campuses now and doing your
question.
tours?
We're working with QI hubs and quality improvement hubs. We are looking, and it's interesting. I just did a visit to Southeastern Ohio with Ohio University.
We'll forgive you for that. It's an
osteopathic school, and they are working specifically. We're working a project with another managed care plan around diabetes, but they are looking at all of the different aspects of their healthcare. And so one of the things that we're doing is they're working with the medical schools. So we're working with I think it's 7 medical schools in Ohio that we're actually doing QI hubs with all the managed care plans, Medicaid managed care plans. We're working collaboratively, and we are serving in those areas to determine what can we do as managed care plans to get you the information you need, looking at how do we better manage these individuals, particularly with hypertension, diabetes are some of the 2 major ones, but also looking at maternal health. And so we're working closely at the grassroots level so that the medical students and the faculty there and the providers, because many of them provide care for our very vulnerable populations. So we want to make sure they have all the tools that we can leverage them, whether it's value-added benefits. Transportation is one that I mentioned earlier, is a big issue. But anything is knowing the services that we have to provide for them. These are things that we're paying for that you need to be aware of that you're not utilizing. So one of the things I have to do in my plan is look at where there's underutilization of services. So when I see a certain service, certain testing, immunizations, a variety of other things that are not being utilized well, I need to make sure we provide interventions to get this out, the message out to the providers. We want you to do this service. We want to make sure that they're getting the, prenatal ultrasounds, which is usually pretty standard. We want to make sure they're getting the vaccinations. So those are things that we're trying to get out and to promote, even if it's not the medical school level, but certainly to provider groups where they are the ones who are the gatekeepers of this care. They need to know these are things that are available.
No, that's great work, man. And I think the impact that you're doing and that you're having on the state is just going to be felt for generations. And so I'm really, really proud of you and your accomplishments and the impact that you're making for families in Ohio and around the country, for sure. I want to talk to you.
I'm in a witness protection program. So when I left private practice, people are still looking for me. It's like, I'm trying to do some bigger things. I'm good.
We call you occasionally, man. It's not that often.
It's all good. I said, how'd you get my number?
Call you occasionally. It's like, okay, I need some help here. No, it's great. It is great. Hey, so I want to wrap up by just kind of asking you, in many ways, like what are things that you do at this stage of your career and throughout your career to keep you motivated, to kind of keep you focused? And then if you could give the audience maybe a couple pieces of advice, that some things that you do on a daily basis to help you, I'll say, build your assets in all areas of life. And it could be in any area. It's not just financial, but it's health, wellness, family, fun, fitness, whatever. There's a couple areas of advice that you can leave, nuggets of wisdom for our listeners. That would be awesome.
Great question. What I call these are my 5 capitals.
Yeah.
And some people may be familiar with these, and I've kind of had as a foundation. So every year I approach my 5 capitals. My first is spiritual. That is the most important one, which for many people of those 5 capitals, it may not be number 1. It may be your last, but I realize that has to be number 1 and be intentional about it. So doing some devotion time to really keep my mind focused on being happy that I'm alive today.
Yeah. Because
I believe there's more of a mission and more service that I believe my God wants me to do. And so I have to look outside myself to understand what that vision is. And many times when I release that to allow God and Holy Spirit to really continue to give me that vision that I would not see by just being inclusive to myself, I lose focus. And I think that's big for me. The other that is just as important, well, maybe not as important, but is next is relational. You can't live without being in community and relationship. First of all, my marriage is number one, and I'm always working on that. I've not been the best steward of it, but I have to understand the importance of that. There's someone who is looking after my back, and I need to really be able to find better ways to be a better husband. But that's a part of the goals each day and, each moment that I breathe. The other thing is intellectual. And when I look at intellectual is where am I going to continue to improve my mind? And as much as I'm trying to avoid the negativity that comes out of social media, those things don't grow me. You can't get away from it. It's there. I don't post too much. I only post when I want to acknowledge something that's positive and moving me forward and other people, outside of acknowledging birthdays for people I don't even know. I think that is important. The other thing is physical. So one of the things to do is, have a regular workout routine, and blessed to have a gym on my basement to really be able to do those things there, but also swimming, finding that opportunity to get out into that medium of water to really be able to just relax and do that. For me, that's a personal blessing to really be able to utilize that. And the last thing is financial. We work to provide a living for ourselves now and going forward, and hopefully to put a nest egg together. And that requires consultation. That requires finding people who can give you a guide for this is what they do. I would say in the African-American community, it's something that we're lacking in because we didn't have parents that, had that wealth to either pass down to us, but that in itself is not always a blessing. You can get past wealth, but if you don't know how to manage it, that's a problem. And I'm learning how to be a better financial steward for my family, but also teaching our children how to better manage that and to be self-sufficient. Because if you got to come back be in the basement, we got problems. Right. It's because I wasn't a good steward of sharing with you how that's important, but putting you on your way, because financial health can be the detriment to a relationship. It could be one where you are spending in the moment. It's okay. But at the end of the day, are you still thinking about how do you bear some of those nuts for the future? That's work in progress, but start early. We teach that with our kids. Again, if you don't have any debt that's there, that's a great thing. If you do have debt, you got to pay that off first and then look at where you go next and start saving, because you will benefit from the work you've done now to later. And so those are sort of my, my 5 capitals. I wouldn't say in that particular order, spiritual being number 1, trying to push financial at the very bottom, but it creeps up at times when you get kids that need things. It's like, oh my God, come on. Right. Now. Come on now. I didn't fit. That wasn't in the budget. Right. So, but that's a blessing. So I took it all as spiritual blessings, and I think God helps me figure out how to manage it better and be humble, be a humble servant.
No, I think that's so good, and we've had some talks on those things, and I knew pretty much where you were going to go. I didn't know all the 5, but we've had those conversations, and I remember just as young men, we were traveling and playing golf, and talking about a lot of these things and how do we impact these things in our life. And I think you brought up some great points, and especially, around the spiritual piece and taking care of that first. It's got to be foundational. And I love the relationship piece, and that's work in progress every day. And it's a challenge, there's no doubt. But then I love the financial piece where it's like starting early and just trying to get, I have 3 sons, and they sometimes are like, Dad, you're putting too much pressure on us, or you're sending us too much information. But it's like, what I'm really trying to help you with. And for me, I don't know how old you were when you first discovered the compound interest thing and all of that. I was probably in my mid-20s. So, a lot of people were getting educated. And even though I was a McDonald's owner and was doing great financially during that time period and everything, there was just something, even compared to my peers, I was still behind, because my peers oftentimes were second generation or had trust or investments. And so the drag that we had on the business was we always had to take money out of the business in order to eat, where a lot of people may have other streams of income so that they didn't have to do that. So just trying to teach the next generation to be great financial stewards, to pay yourself first and make it automatic, and kind of, not necessarily delay life or delay gratification, but just live moderately. I mean, I'm not saying like not take care of your family and yourself, but we all have learned lessons. I mean, I've learned my lessons in regards to living within the means and kind of planning in the future and those kinds of things. And I just think that's so critical for the next generation to learn and understand, having that, setting themselves up for the future, but yet at the same time enjoying life. I'm not saying, don't go travel, don't do things, because I think that's all about your development as well. I want you to do that.
Yeah.
But
I wanted to share one quick story, because this goes back to seeking advice outside yourself, because you will continue you're doing the same thing, but expecting different results.
Yes.
I remember the day when this is when I was, taking care of the kids. You says, Brad, can we have lunch? We went to the White House. That was right around the corner from my office. And you told me, Brad, I'm going to make a big move. I'm going to go to McDonald's. You were Baxter at the time. You were going to go to the McDonald's management programs. I think I want to have an opportunity for an ownership. And that was, to me, I was so humbled to really hear someone wanted to reach out to someone they, saw as a friend who provided advice to your kids to say, let me just share this with you. And I really appreciate that. And I think that was the start of a great relationship, to go back to say, I want to throw this on someone to see if this makes sense. And the first thing I said is, do it. Yeah. Do it. And look what it's done for you in the experience that you had. But one of the things I wanted to emphasize is, for those in whatever workspace that you're in, don't feel that that's your last job.
Right.
Don't be afraid to go on a whim and interest, but be smart. Sometimes you got to keep your day job to do something else until it's proven to be something you can replace. But at the end of the day, don't be afraid and say, I woulda, coulda, shoulda. Particularly women. Don't feel because you had kids, you didn't think you needed to finish school. Go and finish school. Find a way to make it happen. But if you have a supportive significant other or spouse, they'll support you. If they believe in you, go do it, because I don't want you to have regrets. And that's true in anything that you wish you had done. But make sure you seek out advice from those that you trust. And they ain't all got to be spiritual. Right. But someone that you trust who knows you to say, you know what, I got your back. Yeah. And I'm going to tell you when you look like you're failing. So those are things that I think are, things I wanted to kind of leave you with, Phil, and the audience, to really kind of look at that and don't be afraid. And, again, we're all going to fail at some point. The question is, how bad you're going to fail, and can you get back up? Yep, that is for sure. And I remember that day, man. It's amazing how you jog my memory on that. And, I've been very blessed to have friends like you and others in my life that have not been afraid to tell me you're an idiot, or, you know what, you're doing the right thing, go after it. But I think you need that, and you have to be willing to open yourself up for that. And so I think that's a great spot for us to close, man. I really appreciate you, Brad. And you're welcome, Phil. I'm so proud of you. Oh, same to you. I really am. Man. Really, really proud of you. So I think this was great. So, hey, folks, really appreciate you today. I know you enjoyed this episode. Check us out on the BYA Podcast. Check out our website at BYA every day. And we look forward to hitting you with more value-added episodes like this in the future. Brad, thanks again. Hey, take care.